A very warm welcome, Emma, to you, and over to you. Thank you.
Kia ora, Gillian. Tēnā koutou katoa, ko Ruahine Oku Pai Maunga, ko Manotu Te Awa, ko Tangata Tiriti Te Iwi, ko Emma Forbes Taku Ingo. Nō reira, tēnā koutou katoa. So I work with the Commission. Thank you very much, Gillian. I've just got a quick poll, a really quick one that I'm asking Jane to put up for me. So considering ethics, I just want to know if it's true or false. Tell me whether you think it's true or false. Considering ethics only applies if the quality improvement activity is reviewed by an ethics committee. I'm going to give you a few seconds for that one. So quickly, times are running. Hopefully you're all doing it. Yeah, I'm hearing some clicking. All right, Jane, can you just close the poll now and just display the results for me? Oh, look at that. Seems like I don't really have much of a job to tell you guys, because actually I think you're correct. The answer to that is actually definitely false. So I'm going to talk to you briefly about considering ethics in quality improvement. As you all probably know, ethics is a large and complex subject. So I'm really only going to be touching very lightly on it. So my aim today is just to outline why ethics is important to consider in QI, just some key points from the standards, have a brief look at the principles that underpin those standards, and just some things to remember when considering ethics in your QIA projects. So I'm just going to share my screen now. So the National Ethics Advisory Committee standards were released in the standards for health and disability research and quality improvement were released in December 2019. One of the things that's quite unique about them is that they actually, was the first time they incorporated quality improvement into them. It is also where they brought together bioethics principles and Te Aratika framework. The other thing that they did as part of this is they incorporated a risk management approach. So why do we consider ethics? So this is from the standards, but essentially it's around the fact that consumers may experience burdens or risks. It's also that different people may benefit in different ways from the quality improvement activities. We're always using health data as part of our work in quality improvement. And sometimes sometimes some of the activities we do actually can create conflicts of interest. So the principles that underpin the standards are Te Aratika and bioethics. So with Te Aratika, there is whakapapa, which is about relationships, tika, which is about research and design, manaakitanga, which is around cultural and social responsibility, and mana, which is around justice and equity. You'll see that there are quite strong links as well with the bioethics principles of beneficence, non-maleficence, which I always have struggle with saying, which is around don't do no harm, respect for people, and justice. So there are some strong linkages within those things, but it's really awesome that these have been brought into the standards, because actually it's a great way of really underpinning Te Tiriti or Waitangi obligations, commitments. If you do want to know more about Te Aratika, if you haven't read it before, then it's on the Health Research Council's website. You'll see from the from the diagram that's there that Te Aratika is quite an in-depth model, and it's actually got quite some good pointers on how to do research with Māori. So just back to some key points about what's coming through from the standards. So the standards apply to quality improvement activities regardless of whether they are reviewed by an ethics committee or not. Quality improvement activities should aim to limit ethical risk and maximise potential benefits, and that actually those risks need to be assessed regularly and managed throughout the activity. If you reflect on some of the QI activities you have done, you'll remember that there are ways that we come up with new ideas or new things, and so actually when you come up with those, you've really got to make sure actually what's the ethical risk and what are the potential benefits of doing this. So quality improvement activities generally have a low or negligible risk. So this is the guide that we came up with. It's on our website. It's a very much a summary. We aimed it for people who are at the front line around, to help them when they're doing the QI projects and understanding what the ethics is around it. So first off is to define your activity. So is what people are doing research, or is it quality improvement? Because there are some similarities across those two aspects of work, but actually there are some differences. And in the guides and the standards, you'll see that there is, which I'll show on the screen, is that you can see that the human participant research and quality improvement activities have some differences around what they're doing. To kind of help it easy for going forward, what we've done is we have incorporated those into we've incorporated those in some questions, some top level questions into that, so that we can understand actually how do you define research and how do you define quality improvement. The next thing you do is once you've agreed, once you know that you've definitely got a quality improvement activity, you then consider the risks and potential benefits of for that activity. So we've developed some questions related to the principles, for instance, like how will have Māori been engaged with the quality improvement activity? How will this quality improvement activity avoid causing harm to individuals and communities? And who will benefit from the quality improvement activity? So the point of these questions is to help teams decide actually and explore actually what it is, what are the ethical risks and the potential benefits for the piece of work that they are doing. So once you have identified any adverse consequences or ethical risks for participants, you're kind of looking at, you know, is there a risk to their privacy and confidentiality, their physical, their psychological, their emotional, their social and cultural well-being, and their financial. And if you do identify risks, then the key thing here in any good risk management process is to put actions in place to manage these. With data collection, there are additional risks that could come through. So if you're collecting new data from participants, you need to think about whether data collection will put additional burden on participants. Will there be a need for culturally safe and appropriate methodologies? Does the data collection involve information that is sensitive in nature application? And also, do you have vulnerable individuals or groups that you're talking with? And also, will there be a potential for causing distress to participants as part of doing the data collection? The other thing that we tend to rely on is around data, and often we use routine existing data through audits or through our patient management systems or other systems. So the key thing here is that where possible, use non-identifiable data and use it in line with the consent that it's been given for. One of the examples they provide on the standards is that you shouldn't really be using the contact information for patients to try to find out to try to approach them to be part of a survey or an activity. So probably the big thing, and I think we all as QIs, we all like to have a plan. So this is great because we need to have a plan for ensuring the sovereignty, privacy and confidentiality of the data that we collect, that we access, that we store, that we manage, we share, we analyze and we publish. So therefore we've got to make sure that actually all of that plan is covered off as part of it. We need to ensure that data has been collected and will be analysed in a culturally appropriate and equitable way. So that's about strength-based language as well. And ensuring that actually our implicit biases are not coming through when we're doing our collection and our analysis as well. So I've just got some suggested reading for you. There are a whole lot of areas around informed consent. There's areas around research in Māori, research in Pacific peoples, disability research, ethical management of vulnerability, and the whole area of health data as well, which encompasses Māori data sovereignty. So I think if you really want to delve a bit more, like I have, it would be really good to, if you are going to do particular research with particular populations, then make sure you're aware of those particular parts of the standard, because remember the key points, which is that the standards apply to quality improvement activities regardless of whether they are reviewed by an ethics committee. Quality improvement activities should aim to limit ethical risk and maximise potential benefits, and that the ethical risks will need to be assessed regularly and managed throughout the activity. And also, just to note, so that people don't get afraid, is that quality improvement activities generally have a low or negligible ethical risk. So I've just gone through a whole range, a whistle-stop tour around ethics and quality improvement. It's a really light brush. I've talked through why it's important. I've also talked through the principles of Te Arotika and bioethics, which underpin those standards, and just given you a bit of a framework around what the key points are and also what the guide is that we've done. We're really interested to see how your feedback of using it is, so please let us know. So this is where the guide is. So thank you very much.